Serious causes of back pain. While most back pain resolves with time and self-care, certain conditions require immediate medical attention due to the potential for serious complications. Some of these conditions include spinal infections. Although rare, infections in the spine, such as osteomyelitis or discitis, can lead to severe back pain. These infections often occur after surgery or in people with weakened immune systems. Symptoms typically include persistent pain that worsens over time, fever, and general malaise. Spinal tumors. Tumors in the spine, whether benign or malignant, can put pressure on the spinal cord or nerves, leading to significant pain and potential neurological deficits. Symptoms may include persistent pain that doesn't improve with rest, unexplained weight loss, numbness, or weakness in the legs, fractured vertebrae. A vertebral fracture can occur due to trauma such as a car accident or fall, or, in some cases, osteoporosis, which weakens the bones. If a vertebra breaks or cracks, it can cause severe pain and impair mobility. Symptoms may include sudden, intense pain and difficulty moving. Cauda equina syndrome. This is a rare, but potentially life-threatening, condition that occurs when the nerve roots at the base of the spinal cord become compressed. Cauda equina syndrome can lead to symptoms such as severe lower back pain, loss of bladder or bowel control, numbness in the groin area, and weakness in the legs. Immediate medical intervention is required to prevent permanent damage. Aortic aneurysm. In rare cases, a back pain that is accompanied by a pulsating feeling in the abdomen, a deep, constant pain in the lower back, or a history of heart disease could indicate an aortic aneurysm. This is a life-threatening condition in which the aorta, the main artery from the heart, becomes enlarged and may rupture. Immediate treatment is crucial to prevent catastrophic outcomes. When to seek medical attention. While most episodes of back pain resolve on their own with time and conservative care, there are several red flags that should prompt an individual to seek medical attention. Pain that persists for more than a few weeks, or pain that progressively worsens, severe pain that prevents normal activities or sleep, unexplained weight loss, fever, or other systemic symptoms, numbness, tingling, or weakness in the legs or other parts of the body, loss of bladder or bowel control, which can indicate Cauda equina syndrome, history of trauma, especially if there is a possibility of a fracture. Conclusion: back pain is often not a cause for concern, especially when it is the result of strain, poor posture, or minor injuries. However, when back pain is persistent, severe, or accompanied by other symptoms, it can indicate a more serious condition that requires medical intervention. Early detection and treatment are essential in preventing long-term complications, particularly for conditions like spinal infections, fractures, or nerve compression syndromes. If you are experiencing any of the red flags mentioned above, it's important to consult a healthcare professional for an accurate diagnosis and appropriate treatment plan. Common causes of back pain. For the majority of individuals experiencing back pain, the cause is usually benign and can be attributed to musculoskeletal issues. Some of the most common causes of back pain include muscle strain, lifting heavy objects improperly, sudden movements, or overexertion can cause the muscles in the back to stretch or tear, leading to pain. This type of back pain is usually temporary and improves with rest, ice, and over-the-counter pain medications. Poor posture, sitting or standing incorrectly for extended periods of time, such as slouching at a desk, can place excessive pressure on the spine and surrounding muscles, leading to discomfort and pain. Herniated disc. A herniated disc occurs when one of the discs between the vertebrae in the spine bulges or ruptures, pressing on nearby nerves. This can lead to pain, numbness, or weakness, typically in the lower back or legs. Degenerative disc disease. As we age, the discs in the spine naturally lose hydration and elasticity, which can cause them to shrink or collapse. This process may lead to chronic back pain, particularly in the lower back, sciatica. When the sciatic nerve, which runs from the lower back down the legs, becomes irritated or compressed, it can result in sharp, radiating pain that typically affects one side of the body.